Hi, this is Dr. Kang, and today's scuba diving stories goes to cancer and diving. Cancer. Please don't smoke. Smoking gives cancer to our body on almost every organs, not just the lung or larynx. But today I will talk mostly about the cancer itself, what it means to scuba diving, and the rest, the cancers of a certain part of our body, that will be another video clip. So today it's just let me focus on cancer itself. You know, in human body, there are more than 200 types of cancers occurring on 60 or more different organs. Where tumor, a lump, is either benign or malignant. Very rarely there is something in between too. So malignant tumors are called cancers. Benign tumors, we do have a lot of them. I wonder how you read this. It's a wart or Bart. And moles, cysts filled with fluid. Some osteoma in our external auditory canal. That happens when you get exposed to cold water repeatedly. The osteoma grows in our external auditory canal. But osteoma happens in many other different parts of our body. Malignant tumors affect other organs nearby, or even remote organs, and we call it distant metastasis. Some cancers are benign, but they play malignant. For example, brain tumors, spinal cord tumors. They grow a little bit and then they have the compression effect of the central nervous system or nerve tissues and gives us paralysis or sensory disturbance. So even if they are small, still they are confined, so they can give us a bad symptoms. While some malignant tumors are malignant, but still they behave very benign. Thyroid cancer is one of the examples. Especially papillary type and follicular types, they grow very slowly. They certainly metastasize to other organs, but that also takes a long time for the tumor to grow and kill us. So some insurance companies, they are trying or have already taken thyroid cancer in a cancer insurance policy. Anyway, what about cancer and diving? Cancer patient, can he dive? It all depends on, can he or she withstand the hardship of diving and pressure change. Do they have, because of the cancer, do they have sound mentality, maturity, the feeling of sense responsibilities? Oops. And also, diver need power, strength, health for him or herself and bodies as well. Is the site of the tumor free from pressure problem? say like intranasal tumors can block perinatal sinuses. Then we have barotrauma. Some pituitary gland tumors are removed through our nose. Then after the surgery, some of the structures of our nasal cavity and sinus is touched, and they can also cause barotrauma. Is wound safe from getting wet and getting secondary infection? Also, after treatment, is he or she still healthy for assisting himself and the body? It's about post whatever form of treatment. Is there any potential for the tumor or for the cancer to get worse by diving or during diving? This should be the main point of deciding whether a patient with cancer should dive or not. Let's see what forms of treatment are there for cancers. Certainly surgery comes first, and now there's a lot of chemotherapy drugs, agents available on the market. Radiation therapy, very classical and very effective way of treating cancers. Immune therapy was getting popular, and for me to see it's pretty stagnant. There seems to be some limitation, but still this is studied, this is executed. In many parts of the earth, people have desire to treat all kind of disease by natural power. They change their diet, they change their water, and they change their form of life. This helps or not? I personally don't believe this. But still there's a lot of people, after all these treatment methods, or even without them, many people try natural therapy or healing procedures. Surgery. We have to look at the size of the tumor and where the cancer came, and scope of surgery. For example, if you have cancer on your larynx, the vocal cords, not always, but most of the time, if you find them too late, you have to take your larynx out. Medical term is laryngectomy, which I have done hundreds in my life. And if you do partial laryngectomy, you can still talk and you can dive. But when you have to do the total laryngectomy, you make a breathing hole here, you breathe through the hole, and you can't talk except unless you learn how to talk using your esophagus. This makes it impossible to dive. A long time ago, there was an article in English medical magazine that they put some device around their neck and the patient could swim, but diving is impossible. About other cancers, I will deal later on. Also, the scope of surgery, how much tissues do we take out? That is a very important factor in deciding if post-operative cancer patient can dive or not. There are chemotherapy. It is effective in treating cancer cells, but most chemotherapy drugs have various complications here and there. Mostly it's about the lung. So pulmonary function goes down, which make it very difficult to dive. Some chemo make you go nuts. There is some mental function or disorientation coming from that. So some of them give you gastrointestinal complications, and you keep on vomiting, and nausea will kill you. Some chemo gives you urinary disturbance. You cannot really accumulate the urines much enough in your bladder, and you keep on urinating. There are other complications. The reason I'm telling you all this is you have to wait until the effect or complications of chemotherapy completely leaves your body, and then you reassume diving. Radiation, also very effective, but radiation is like burning you. It burns the cancer cells, and it also burns the adjacent nearby tissues. But non-cancer tissues, they come back after the radiation is done, but cancer cells cannot. That's the principle of radiation therapy. Whatever. It gives you, if radiation is done around your lung, it gives you some fibrotic change to your lungs. Your oral mucosa will burn. There will be no saliva coming out of your salivary glands, giving you a dry mouth. These are also reversible. So after a certain period of time, they will go away, or much of them will go away. You have to wait until this disappears from your body. This was some briefing on cancer, and next time I will bring up some forms of cancer and deal with them one by one. So again, thank you very much, and I'll see you very soon.